Our patients with neuroendocrine tumors may produce various hormones that cause symptoms and troubles in their life, and it can be a fascinating and a diverse array of situations that they present with. One of the most common is the Carcinoid Syndrome, typically from carcinoid tumors of the small intestine that produce serotonin and perhaps other biologic amines. This classically causes diarrhea and flushing, rarely hypertension, wheezing, other symptoms, and can be quite function limiting. With this, somatostatin receptor analogs, such as octreotide or lanreotide, often result in very significant improvement in their symptoms, improvement in their quality of life, and can be quite useful. Many patients with pancreatic neuroendocrine tumors or neuroendocrine tumors of other primary sites can produce a vast array of hormones, some of which can cause life-threatening troubles, such as insulin, ACTH, cortisol, vasoactive intestinal peptide, or still very other bothersome syndromes such as gastrin production, stomach acid troubles, and various other hormones. And sometimes they can produce 1, 2, or 3 different hormones that affect them. In that situation, somatostatin receptor antagonists also can be helpful, though I find it less likely that we significantly improve difficult symptoms than we do in the carcinoid syndrome. So for all these patients, if they are not well palliated by somatostatin receptor antagonists, we can look to try and give therapy that may reduce the tumor bulk, whether this be systemic chemotherapy, regional therapies that go after large metastatic lesions in the liver, surgical therapy, peptide receptor radiotherapy. The goal would be to kill as many tumor cells as possible to reduce the production of the hormones and palliate our patient's symptoms significantly. The carcinoid syndrome is a description of symptoms that often arise in patients with carcinoid tumors from the serotonin production. So it often consists of the flushing, diarrhea, and occasionally other symptoms such as hypertension, wheezing, spells, sometimes fainting spells some patients will experience. That's the carcinoid syndrome. Prolonged carcinoid syndrome can scar and thicken and impact the ability of the heart valves on the right side of the heart to function well, so that they leak, threatening the function of the right side of the heart, and that's a very severe complication called carcinoid heart disease. And occasionally patients with carcinoid syndrome can have the carcinoid crisis, which is an abrupt hemodynamic instability brought on, we think, by a massive discharge of serotonin, usually triggered by general anesthesia, perhaps hepatic artery embolic therapies, and other emergent situations.
The quality of life of patients with neuroendocrine syndrome, and when the syndrome is not very controlled, can be quite impacted and affected by the disease. These patients can have significant amount of diarrhea a day. Some of my patients reported that they have more than 10 bowel movements a day with perhaps explosive diarrhea. They cannot leave the house. They cannot have a functional life. So controlling the symptoms are very, very important. They also can have a lot of flushing that can be uncomfortable to them as well. In cases of atypical carcinoid syndrome symptoms, you can have bronchospasm that you can see in lung patients. So controlling that with medications that we have available or interventions such as surgery or embolization of the liver are very important to try to minimize the carcinoid syndrome and improve the quality of life of these patients.
Neuroendocrine tumors are often characterized by the propensity to produce hormones, and the most common one is carcinoid syndrome, which is caused predominantly by serotonin secretion, but also by other vasoactive substances. So first of all, the somatostatin analogs obviously are really the cornerstone of symptom control. They've been used for many years for various hormonal symptoms, not just carcinoid syndrome, which is characterized by flushing and diarrhea, but also other rarer hormonal syndromes associated with pancreatic neuroendocrine tumors, such as VIPomas or glucogenomas or gastrinomas. Beyond that, there are other treatments that can be used for symptom control. There's a serotonin inhibitor, telotrestat, Zermelo, that's used for refractory diarrhea associated with carcinoid syndrome. It's an oral serotonin inhibitor, and it's quite effective at reducing diarrhea in patients who remain uncontrolled despite use of somatostatin analogs. But it's also important to consider many other causes of diarrhea that these patients may experience. For example, pancreatic malabsorption, which can be caused by either somatostatin analogs or in some cases by pancreatic surgery. It's important to consider bile malabsorption caused by often by right hemicolectomy, short bowel syndrome. So there's many other factors involved that we need to consider.